In this video at Medical Sciences, we want to discuss about CNS stimulants. Among the CNS stimulants, previously we looked at alcohols. Then in this video, we are going to look at amphetamines. And so we're going to look at amphetamines and methylxanthines. So as we are beginning, we always urge you to subscribe. Why do we tell you to subscribe? Is that you can always be notified whenever we release our videos. Like the video and share to others. So CNS stimulants, these are drugs. These are drugs that when used, they increase the concentration, or they increase monoamines, that is serotonin, that is the 5-hydroxytryptamine, they increase dopamine, and they increase norepinephrine in the synaptic cleft. And when these neurotransmitters, which we call monoamines, increase in the synaptic cleft, they lead to the increase in alertness. They cause arousal. They lead to excitement. They can also lead to excitement, sense of excitement. So this is what we can talk about this. So they increase alertness, arousal, excitement, and after doing excitement, they also increase motor activity. They can increase the motor activity, and at the same time they decrease appetite. Appetite is decreased. So these are the effects that come about due to increase of these monoamines on taking these CNS stimulants. So their major role of action is to make sure they increase levels of monoamine, that is serotonin, norepinephrine, and dopamine. That is what we can. And we are going to see these drugs. The end result, when used for long, they result into withdrawal syndromes. They can result into tolerance and addiction. That is what we can talk about: tolerance, addiction, and withdrawal symptoms when stopped after being used for a prolonged time. And one of the examples we are going to see is amphetamines. And these amphetamines, their mechanism of action, we are going to see different examples of amphetamine, whereby we shall have examples of amphetamine include amphetamine is an example. We shall see examples like dextroamphetamine, you can see another example as shall see even methylphenidate is also a derivative of this methylphenidate. Then lastly, we shall look at MDMA. This one is known as methyldioxyamphetamine. Or we can also call it ecstasy. Or these are moletabs. When the trade name, they are called moletabs. So these are different forms of amphetamine or derivatives of amphetamine, and their mechanism of action. These amphetamines are non-depolarizing catecholamines. We know these are non-depolarizing, or they are non-catecholamines, which include, so amphetamine is a natural one, then these are the derivatives of amphetamine. And we're going to see that their mechanism of action, the mechanism of action is that they act by increasing release. If in the synaptic cleft we have our monoamines, we have our serotonin, we have our dopamine, we have our norepinephrine, what these drugs do, they increase the release. They enhance release of this neurotransmitter from the synaptic cleft, from the synaptic vesicle into the synaptic cleft, so that these neurotransmitters are released by exocytosis. So one of their mechanisms of action is to increase the release. After increasing the release, they also come and block reuptake. We see we have dopamine reuptake transporter. So this reuptake of dopamine, we shall have reuptake of norepinephrine through norepinephrine reuptake transporter, and we shall even see reuptake of serotonin through serotonin reuptake transporter. So these transporters are also inhibited, or they are blocked by this amphetamine. So that is the mechanism of action, by increasing or enhancing release and also blocking reuptake. Those are the mechanism of action, whereby we are saying either this the mechanism of action is they act by enhancing or they enhance release of monoamines, which we have listed as norepinephrine, dopamine, and serotonin. And the second way is that by they inhibit reuptake by blocking NAT, norepinephrine reuptake transporter, by blocking serotonin reuptake transporter, and by blocking dopamine reuptake transporter. But majorly they target NAT and DAT. So that is their mechanism of action, the way we have seen it here, blocking their reuptake and enhancing the release by exocytosis. And when these neurotransmitters they are released and they are not being reuptaken, it increases their chances to bind on the receptors on the postsynaptic neuron, hence increasing transmission of the action potential. That's why it brings about mental alertness. They are aroused or they become more excited. It increases motor activity and increases appetite. That is amphetamines. And these amphetamines, we are going to see one by one where they are applied, but majorly these amphetamines, their application, can remove this. The amphetamines, you can transfer these ones this side. Modafinil. So these amphetamines, they are being applied, or their actions, they are being used in treatment of attention deficit hyperactivity disorders. That is one. We can use these amphetamines. They are being used in treatment of narcolepsy. That is also another indication of these amphetamines, treatment of narcolepsy. Then we can also use them. Narcolepsy, what is narcolepsy? Narcolepsy is dead sleep. Due to fatigue, you find someone every time is sleeping, no alertness, no mental alertness. So that is what we call narcolepsy. So excessive sleeping disorder. And apart from this, another drugs which you're going to see which are good for treating narcolepsy is modafinil. This modafinil and modafinil, they are also another category of drug which are used in treatment of narcolepsy. These ones can also be used in treatment of narcolepsy, whereby it decreases fatigue and alertness. So these ones, modafinil and modafinil, they are good for night workers, those who work at night shift workers. So those ones which do night shift, to increase their alertness when they are fatigued, is we can use modafinil and modafinil, which are good compared to amphetamine. And we shall see another good agent for treatment of narcolepsy is atomoxetine which atomoxetine for it is selective inhibitor. It is a selective inhibitor of norepinephrine reuptake. So it is also being used for treatment of narcolepsy. This one is also being used, but for it only inhibits norepinephrine reuptake, hence increasing the concentration of norepinephrine in the cleft, hence enhancing the activity and mental alertness, and also for night shift. But this one is contraindicated, should never be combined with monoamine oxidase inhibitors. This one should not be given. With fluoxetine, paroxetine, they should not be given in combination. That is the precaution we take when using atomoxetine, which is a norepinephrine selective reuptake inhibitor. So after seeing the amphetamine being used in attention deficit hyperactivity disorder, what we can call hyperkinetic. This one you can also call it hyperkinetic. What is it? This is a condition where you find children or adults, they cannot be attentive on one thing. If you start this one before they finish, they have this, and we have seen many with this disorder. So you can always treat it using amphetamine. Amphetamines are the drug of choice for doing that. But their side effects are many. They can bring about insomnia, it can lead to mental confusion, and their withdrawal can bring about seizures and so forth. So they can even increase blood pressure, what you call hypertension. Those are the side effects of this amphetamine. And the dextroamphetamine is better, is more potent than amphetamine, whereas methylphenidate is also 10-fold potent than amphetamine. And this methylphenidate has been demonstrated to be good in the treatment of narcolepsy and ADHD and narcolepsy in children above 6 years. It is very good for, and it has also proved to increase their learning ability. The experiment done on people who are on methylphenidate has shown that this one increases the learning ability of these children when they are on methylphenidate. That is very important to note. Children between 6 to 16 years. Then modafinil and modafinil also for narcolepsy. Then there is this one which is known as Molletab or drug of ecstasy. This one, it is used for people who are shy in public, and those singers who want who have shows, they normally use these Molletabs, or what we are calling drugs of ecstasy, so that they are excited, they can be able to excite the crowd. So these Molletabs, what we are calling methyl dioxyamphetamine, is being used as the drug of choice for public speaking or for public excitement to take away shyness. That is what we call Molletabs or drugs of ecstasy. And their mechanism of action majorly, they increase serotonin concentration. They act by increasing serotonin, and when serotonin is increased in concentration in the cleft, it causes this excitement and sense of excitement. That is what we are calling Molletabs. So majorly used for public speaking and performance. That is Molletabs or drugs of ecstasy. The trade name they are called Molletabs. Then another thing we can talk about, the indication of these amphetamines, they also decrease fatigue. They decrease fatigue. In case you have done much work and you're fatigued, you can easily take these drugs. But another thing we saw, they depress appetite. So people who are on these drugs, they have little appetite. Then another drug we can talk about is cocaine, whereby cocaine, we saw it inhibits reuptake of these monoamines, reuptake of serotonin, reuptake of monoamines, especially norepinephrine. And this cocaine is also a psychomotor stimulant or a psychostimulant, which we can also talk about in this session. So cocaine can also be used to increase excitement, mental alertness, and so forth. But it has much side effect, whereby this cocaine has ability to increase heart rate. It increases heart rate, so meaning it can lead to hypertension. It can cause mental confusion. It can lead to seizures, that is the withdrawal symptoms, seizures, tremors. These are some of the withdrawal symptoms in case of being addictive with cocaine. But is also being used as a CNS stimulant. Then caffeine, which is a methylxanthine. This is a methylxanthine, which is in the same category with the theophylline. But among the methylxanthines, that is caffeine and theophylline, only caffeine is a CNS stimulant. Theophylline for it is used as a bronchodilator. So we're going to see this caffeine, which is found in the drinks, like cola drinks, coffee drinks, cocoa drinks, and chocolate candy. These ones are found in the drinks. And caffeine, its mechanism of action, it inhibits, this one inhibits an enzyme known as phosphodiesterase, and after inhibiting phosphodiesterase enzyme, it leads to increased levels. This one leads to increased levels of CAMP and guanosine monophosphate. And when they are increased, they are the one, and also it has action by binding on the adenosine receptors. And when they are inhibited, now increased levels of CAMP increases cellular activities, hence increasing arousal and excitement. And this caffeine, it is not therapeutically used alone, but is being used in combination. Therapeutically, the use is being used in the combination whereby caffeine is combined with analgesics like aspirin or acetaminophen in the treatment of pain or headache. Then caffeine can be combined with ergotamine. It is being combined with ergotamine in the treatment of migraines, people with intermittent headache. So with the treatment of migraines, we combine caffeine together with ergotamine, then the caffeine with aspirin or acetaminophen to act as analgesic. But it is not being used as alone, but used in combination. That is what we can talk about caffeine. Then atomoxetine, we have already talked about it, which is a selective norepinephrine reuptake inhibitor, also indicated in sleep disorders, deep sleep disorder, whereby when taken, it increases wakefulness. It increases wakefulness so that you can pay attention to the work. Then lastly, we can discuss is nicotine. And this nicotine is also a CNS stimulant which acts on nicotinic neuronal receptors and nicotinic macellary receptors. And this nicotine at low dose, it causes depolarization. It is a stimulant at low dose by causing depolarization. Then at high dose, it is a depressant. It depresses CNS. So at low dose, it causes excitement. It causes excitement at low dose, by causing depolarization of nicotinic receptors. Then at high dose, it deplaces the CNS. That is nicotine, and medically it is used as a nicotine patch or in nicotine gum for treatment of people with withdrawal symptoms, or to treat drug addicts. That is what we are using nicotine, especially nicotine transdermal patch. When applied topical on the skin, it is released slowly and it can be used for drug addicts so that they can seize other addicts like those who are addicted with cocaine, with amphetamine. You can use nicotine patch, but it does not cause withdrawal of cigarette smoking. That is an exception. So that is, but majorly important is that nicotine at low dose is a stimulant, whereas at the higher dose, it causes CNS depression. So the side effects of this cocaine, of nicotine, it can be tremors, insomnia, convulsions, mental confusion, memory loss, and so forth when taken in higher dose. That is what we can discuss about nicotine. So in this session, this is what we're able to discuss about CNS stimulants, whereby alcohols, for them, we covered them in the different session. So we have seen amphetamines, and we have seen different indications of them in the treatment of attention deficit hyperactivity disorder and narcolepsy, and also treatment of fatigue, though they also decrease appetite. Then we have seen cocaine with what it does, modafinil and ammodafinil for narcolepsy, together with methylphenidate in children. Then we have seen cocaine also as a CNS stimulant. Then caffeine also being used, and its mechanism of action being a phosphodiesterase inhibitor, increasing CAMP levels, but used in combination with other analgesics for treatment of pain and migraines. Then atomoxetine, a selective norepinephrine uptake inhibitor, cause for treatment of narcolepsy, or by increasing wakefulness. So atomoxetine, modafinil, and ammodafinil are good for night shift workers to increase the wakefulness so that they can be alert to increase their performance. Then nicotine, where we have seen at low dose, is a stimulant. Then at a higher dose causes depression, and medically it is used as a nicotine patch or a gum for treatment of drug addicts. Thank you so much for learning with us. We are always privileged to have you. And always make sure to remember to subscribe if you haven't subscribed, to like the video and share to others. Thank you so much.